Alrighty then. Hello, this is Laura. Okay, so I received this yesterday along with another folder, and it has all kinds of stuff in it. Apparently I'm gonna meet like the nurse. Doctors have a bunch of nurses under them and stuff like that. So this nurse for my oncologist, I think she's with her. Whoops, why is this open? Whoa, oh no, I didn't know this was open. It fell open. Ah, uh-oh, I gotta fix it. Well, that's nice. Um, ah, it all came open. Yo, what happened here? Anyways, so she gave me this and it has all the contact information of different people. Oh, I gotta take this apart and put it in I need to put this in my wallet. You are not alone. Yeah. Okay. Chemotherapy, types of chemotherapy treatment, managing adverse effects of chemotherapy. You want to look for and monitor while on active chemotherapy. Okay. And that's a whole bunch of stuff to read. I really am not into that. I usually have something read for me so I can do doing something else. But there we go. We have to read all this and we can put some notes here. Yay. Now, here's the stuff that I really need to read. So I'm going to be on a couple things. They're going to give me, all right, Adriamycin. Adriamycin, which is also called doxorubicin, and it's used for all of this stuff. And it's a generic name for the trade name. Yep, okay, and is an anti-cancer chemotherapy drug administered via IV through a central line or a peripheral venous line. I'm going to have the peripheral venous line, which is a port somewhere here, and the drug is given over several minutes. Well, I have to be there for 4 hours, so I'm not really sure how this works yet. It's given by continuous infusion through a central catheter line. There is no pill form. It's a vesican. Vesican is a chemical that causes extensive tissue damage and blistering if it escapes the vein. The nurse or doctor who gives this must be carefully trained. Oh, thank you. If you notice redness or swelling at the IV site while you're receiving this, alert your healthcare provider immediately. Holy moly. Oh, oh my gosh. And all this stuff. Urine may appear red, blah, blah, blah. Darkening of the nail beds. Oh, okay. So I have to read all these details. They talk about your temperature because they gave me a thermometer. Wow. Okay. The second one, cytozan, also called, that's a generic name. Gosh, we got 3 words here. So the next word is cyclophosphamide. Cyclosphamide, also called Neosar. Sounds easier, and EOSAR. So, what is it? It treats Hodgkin's and non-Hodgkin's lymphoma. Okay, so that has to do with the lymph node up here. That's what this is probably for. Okay. The amounts determined on many factors, including your height, weight, general health, and blah, blah, blah. So that's the second drug. The first one had a lot of red highlights, so I guess I have to really read that one carefully. Pay attention to all those details. This one doesn't have any highlights. But I need to read it. Okay, so the third one, see, they got 4 things here, so try to figure out what this is about. So the third one is, oh gosh, how many words we got here? So, I mean, look at this. Oops, see if I could do this. It's backwards, you can't see it. Okay. Neulasta, and then Onpro, 2 words. Neulasta Onpro. Sounds like a camera. Okay. Generic name. Pegfilgrastim. Pegfilgrastim. Okay, trade name. Oh, that was the trade name. Neulasta Onpro. Okay, other names. G-CSF, comma, granulocyte, GRANULOCITE dash colony stimulating factor. Woo, okay, what is this? So we have lots of highlights here. Must be important. This medicine, oh, okay. This medicine, now this one I like. Okay, good. This medicine is used to stimulate the growth of healthy white blood cells in the bone marrow once chemotherapy is given. So I won't have this yet. This will be later. White blood cells help the body to fight infection. This is not a chemotherapy drug. Oh, all right. That's not what this is. So this medicine is usually given at least 24 hours after chemotherapy. Oh, this will be the patch. That's what this is. This is going to be a patch to stimulate the growth of new healthy white blood cells. So I'll have that on for a certain amount of time. It says on body injector that delivers with an under the arm injection. So they'll put the patch on there. Okay, that's what this is. It has to do with that. Bone pain may be relieved with over-the-counter medications. Yeah, okay, I'm used to pain. All right, so that's the patch. Okay, so what's this other one? So that has to do with stimulating white blood cells. So this one, what is this one? This one is a Taxol is Paclitaxel. Woo! Paclitaxel. Who thinks of these names for pharmaceutical products? Who creates the names? I'd like to know who's in charge. Why they create them the way they do. Other trade name Onxal, AONZONXAL. Now I am familiar with the the scientific table, periodic table. Maybe it has to do with that. Anyways, what is Taxol? Taxol is an anti-cancer, anti-neoplastic, or cytotoxic chemotherapy drug. Whew! It is classified as a plant alkaloid. Okay. It's used for the treatment of breast, ovarian, lung, bladder, prostate, melanoma, esophagus. I can't say that word. As well as other types of solid tumor cancers. Yeah, mine's a little solid tumor. It has also been used in Kaposi's sarcoma. If a drug has been approved for one use, physicians sometimes elect to use the same drug for other problems if they believe it might be helpful. Taxol is given as an injection or infusion into the vein, IV. Taxol is an irritant. An irritant is a chemical that can cause inflammation of the vein, through which it is given. If the medication escapes from the vein, it can cause tissue damage. Great. The nurse or doctor who gives Taxol must be carefully trained. If you experience pain or notice redness or swelling at the IV site, oh, you know what? This is why a port is very important, because a port is an input into, you have one input into the IV with the port, and then you put the medicine in the port instead of in you don't have to reinsert and look for a vein every single time you go back. Well, that's a very good idea because I don't have great veins. And so I need a good one and then nothing else to be touched. Yeah, so that's good. Okay, so that explains the port, which is definitely what I will do. I have the port inserted on the 16th. So I'm understanding all of that. And, that's what makes this very important to have the port. I don't want them to reinsert and stick me several times. Just stick it in the port, not me. So I'm glad they got that figured out. Nobody wants to be restuck for hours at a time, 2 or 3 times a week. Oh my Lord. But anyways, it talks about other changes. Okay. So it's good I have to read the side effects and stuff. I'll explain anything if anybody has a question. If anybody writes a question, and I see the question, then I'll make a video about it. No problem. Okay. When to contact your doctor or healthcare provider. Fever of 100.4, chills, possible signs of infection. Shortness of breath, wheezing, difficulty breathing, closing up of the throat, swelling of facial features, hives, possible allergic reaction. The following symptoms require medical attention but are not an emergency. Contact your healthcare provider within 24 hours of noticing any of the following. And then it has redness or pain at the injection site, which I won't because it'll only be one that happens on the 16th. Nausea, vomiting, diarrhea, unusual bleeding or bruising, black or tarry stool or blood in your stool or urine, extreme fatigue. Yeah, well, mouth sores, whoa. Yellowing of the skin, oh no, I don't want that. Jaundice, no. Swelling of the hands or feet, sudden weight gain. Oh, trying to lose weight. Signs of infection such as redness or swelling, pain or swallowing on swallowing, coughing up mucus, or painful urination. And then it has all this other stuff. Ugh. It talks about people being pregnant, which is not me. So those are my drugs that I will be taking, or they give me rather, when I go in. I go in on the 19th, says treatment. Uh, uh, Here. Let me go to that. Okay. We're looking at the other screen over here to make sure I see what. Look at the appointments. My brain goes 100 miles an hour. Okay. And this is totally separate than the other problem. I need two completely different surgeries that relate to two completely different things. And I have to wait to get the other one while I stay in pain. I don't, the other thing I wonder, oh, yeah, I have a lot of question about. I just thought of that. Okay, wait. Okay, brain, hold on. Okay, so on the 16, all right, I'm not going to need this one. No, the 19th. What? Oh, the 19th in the morning. I won't need that one. Okay, the 16th. Okay, the 16th, I'm going to be getting the port. The 19th, they want to tell me how to deal with pain and stuff. Really? I think I know more about pain tolerance than just about anybody anywhere. I don't need this one. I'm canceling it. I told her I told the oncologist I don't need it, and she said, I don't think you need it either. Yeah. Why? Oh gosh. Now I really got myself in a pickle. Oh, okay. All right, fine. I have to type this out. I forgot it. Okay, I just canceled it. Maybe I'll go back and cancel it after I get done recording so I can type something out. So we'll just do that. We're not going to cancel it yet. All right, go back to visitors. So where was I in the recording? On the 19th, other than the morning one I'm going to cancel. Okay, it says hematology oncology lab visit. 11:45, 15 minutes. Office visit, 12:30, 30 minutes. And then treatment, 1:15, 4 hours. Okay, that's what it says. I don't know what this is going to be like. I don't know anything about it. Okay. And then September, or not September, February 2nd, I have the same thing. 3 appointments that are set up. 8:15. Lab, 8:45. I meet the oncologist. And then 10 o'clock, or 9 o'clock, I meet the oncologist. And then 10 o'clock, 10:15, I do the treatment. And that will be 4 hours. Why is the treatment 4 hours? It takes them 4 hours are they dripping it in there or what are they doing? That's why I meet the oncologist right before treatment. I don't understand what's going on. All right. Okay. And then we have February 7th is that's dermatology. I have this rash all over. That's another problem I don't understand. So I have a rash everywhere. And then February 16th is going to be a long day for the chemo. So we have January 19th, February 2nd, and February 16th. Yep. And then February 21, that's in internal medicine, a new doctor that I was trying to see a doctor. All right. So I guess after the 16th, I'm sure, they're going to redo a mammogram and, CT or whatever. They're going to redo the scanning to see what the chemo is doing and see how I'm doing and stuff like that. And I I I honestly I don't mind doing all of the treatments because I want to get better and everything. It's just all of this time and I don't know what it's going to take out of my body energy because I really want to work. So, all right, I'm going to have to cut this off now because I'm getting a little emotional. So, all right, so there was my update, and that's what it is right now. Have a great day. Thank you so much if you donate, and if you can't or whatever, that's fine. And please share. That would be so, so helpful if you could at least share. I appreciate it. I wish I could give more to others. I don't wish this on anybody. Oh my gosh. Uh, okay. But I will share everything that I experience so that I can help someone know what to look forward to or, you know, what it's like, or it won't be the same for them, but um, I don't want them to feel alone, and this is what it is. So, okay. And then, anybody can talk to me if they need to about this kind of stuff. And whatever I know, I'll tell you. If I don't know, I can't tell you. So, I wish everyone wellness. Thank you so much. Bye bye.